Our speaker this morning is Faith Bresnan Roberts, right over here. Faith has been a nurse in community, acute, and ambulatory settings. She has practiced in 5 states and holds her certification as a Nurse Executive Advanced. Faith has presented at the state, national, and international levels. She has published on topics close to every nurse's heart. This morning, her presentation is entitled, What Brings You Back? Please join me in welcoming Faith Roberts.
I'm glad to have you. Thank you. Good morning. I love nursing conferences because it doesn't matter who you are, where you are, the back tables fill immediately. And as a speaker, sometimes it's kind of crazy, but it is fun to watch. So I need to say a couple things. I am not an oncology nurse, so I know I lost 10 points right from the get-go. But I'll tell you something that I have always found fascinating about us as professionals with the specialties that we all work. In case you don't know it, I think you do, but in the acute setting, critical care wins, okay? I work neural rehab. Okay, so one of my favorite research studies, they said nursing students in a BSN program, senior year, here are 40 things you can do as a graduate BSN. You can work in ambulatory, you can work in acute, you can work in community. You can work for the government. You can work critical care, ICU, PCU, SICU, CV, all the U's, right? You can work OB, you can do all of these things. They listed 50. You can work in a nurse practitioner's office with a nurse practitioner, all of these things. Now, rate them. 1 through 40, 1 being the very first place you want to practice, 40 being dead last. No surprise to everyone here, all the ICUs were in the top. Neural rehab was 40. Jail nursing beat us. I'm just saying that when you get started in your career, you'll find that for some people it's that first interaction with a patient and you thought, this is what I like. For a lot of us, gosh, I've done OB, I've done public health. I've done a lot. But I find neuro, to me, makes the most sense, and I really enjoy it. But that never took away the respect I have for what another specialty does. Maybe I didn't know I respected them until I needed them. Nothing makes me happier when I worked OB. Well, I shouldn't say happy, but at least a couple times a year. A mom will kind of have a real rough time and we gotta flip them up to the ICU. And then they always call and say, get a labor nurse up here. And you run upstairs and there's ICU nurses running around a bed going, what's a fundus? What's a fundus? What's a fundus? That brought me joy. When I talk about today, what brings you back, it's simply this. Every time I look at nursing now, having been in leadership for a good portion of my career, I'm in so many meetings where there are so many trendy ways to talk. We're going to have to unpack that. Yeah, we're going to have to unpack it. I'm going to put a hard stop, just a real hard stop on that. And when I'm in those meetings, I always want to say to these people, do you know you're talking crazy? Like if you said that on the psych unit, you might have to spend the night, right? When I say what brings you back, it's simply that thing about why did you come into nursing and then how stressful nursing is. I do enjoy that one too. I guess the first part of my career wasn't stressful because it's stressful now. Nursing has always been stressful. because the fate of a human being rests in our hands. And when people want to talk about settings and start talking about which person works the hardest, get over it. Nursing is hard. One word from a family can make your day or suck your soul out. One victory with a patient can keep you going for quite a while. One loss might mean that you call in for the next 3 shifts because you can't bear it right now. Getting people to understand that, it's just this trendy statement right now that drives me nuts. What keeps you up at night? Wow, that's a soul-sucking question. That takes away any thought that what my work does matter. Instead, I want to flip it to what brings me back. I've never come back for a policy. I've never come back for a new initiative. I come back for 3 reasons. My patient, their family, and you, my coworkers. And I've never had all 3 hit on the same day. If that ever happened, I would know I was on drugs. All right? I come to work for my patient. There are times, you guys, and I know it doesn't happen in this area of the country, probably just in Illinois where I work, but there are days that you come to work and you're mad when you wake up. You ever do that? You wake up, I've got to go back. I hate that place. Oh, they suck my soul away. And on the way, I'm on the 8th floor, I get on the elevator and I just press every single button. And this is how I do it. They can just wait for me. And that elevator starts jerking up 1 floor at a time, and I think I hate this place. You know what? I'm going to quit. Today's the day. I think I'll quit at noon just to watch their sorry little mouths drop open. And then the elevator doors open on neuro rehab, and one of my brain-injured patients' family is there, and they look at me and say, "Oh, Faith, oh, are you on? Oh, good." And I think, I'm back. I come to work for my patients, my family, and my coworkers. I do not come to work for insane, inane things that I have to follow and do. I follow them. I get it. I want there to be a policy on things. Because for every policy that's been written, there's a nurse in this room who can tell you a story about why we had that policy. Like the night in labor and delivery, we kept hearing this woman moan, and we checked all the rooms, and we couldn't find her. And then someone said, "I can't get out in the hall." They kept pushing the door, it wouldn't move because the woman was delivering in the hall outside of labor. And I still remember when the door got open and we all looked, it was just like, they're gonna need a policy for this. It is so hard to explain to people outside of healthcare what we do. You know that because you are all angels, aren't you? Every specialty gets a term, an oncology. My favorite is your friends either say, "You're an angel," or "That is so sad." Some of the most raucous laughter I have ever heard comes out of oncology. It is the gift that you have to get past a moment and see the whole person. It is the gift that you have to say that although many of your patients may have gone to the next place, you got to meet them in this place. For every person who did a poster, and those posters are stellar, but they also speak to what's going on in your cancer centers. I love posters. I get to go to a lot of conferences, but what I love is We are still trying to find the best way to bring a new nurse into our specialty. You've got some fabulous ideas over there. But you and I, if we had to be pushed, a lot of that nurse's feelings happened the very first day, with how they were greeted and with how people were like, what? No, I took the last one. I'm not taking another one. Oh, I want to build my professional life off of you. Think of just, if you come to work for your patient, the family, and the coworker, it's just this. Some of you have made the mistake that I made many times in my life. I went home and tried to tell my family a story about work. And it loses power on the way home, you know? Because it was a good story. But I'm halfway through the story and I look over and my whole family at the kitchen table's like this. That's gross. And I always say, no, I'm not to the good part. It is trying to explain what happens inside the walls of someone's home, the clinic, the infusion lab, in rad-onc, hematology. It's trying to get people who don't work ambulatory to understand this. You work just days. That's so nice. Really? Because it's 11 a.m. and I'm going to kill somebody. Why, you have every weekend off. I need one. You do 3 12s, I just did 5. Okay? It's getting people to understand that the issues that patients and their families have, when all said and done, don't differ from inpatient to outpatient. Oh my gosh, okay, I'm from Central Illinois. We have something called a snow day, okay? So when snow days hit, every inpatient nurse says, wish I worked in ambulatory. They close the clinic. You work with one of the most famous oncologists in the area, in the country. People wait 6 months to get in and see that physician, and today's appointments were canceled. You get the hard work of calling people who have waited that long to tell them the appointment has disappeared and they're now back in line again? No. I'm tired as a professional of judging my practice against other people's, because I like what I do, you like what you do. It's different. When I say we work for our coworkers, I simply mean this. The neural rehab unit where I work, we have a young healthcare tech who a few years ago announced that she was going to have a baby. Next to the OR, because OR always wins for seniority, but next to the OR, neural rehab is the second most senior staff at our facility. You know how long it had been since we'd had a baby shower? It had been decades. And what I loved about it was our unit secretary said, you guys, you know what makes this fun? When you were all pregnant, we just kept passing that same sorry $5 sleeper around. She said, now we're old, we're grandmas, we got money. We're gonna make this a good shower. We were all excited. Halfway through her pregnancy, she announced that the father of the baby would not be involved in the baby's life. That is very sad. We just went out and bought more, all right? So the day of the shower came, and I'm running around. I was in charge of the punch. Anyway, if you know anything about neural rehab, it is very structured care. Everyone must be in therapy at certain times. So I'm getting my patients ready, and they were bugging me, just to be honest. They kept turning on their lights. I need something. I need to go to the bathroom. I'm hungry. I was like, stop. We are having a party at 1 o'clock, and I'm making the punch. 1 o'clock, if any of you have ever worked rehab, maybe you remember 1 o'clock, because what? That's when everyone has to be in therapy in the afternoon. So we have all our parties at 1 because they're gone. That day it was a great shower, but that day I was driving home and a little voice in my head said, Faith, were you a good nurse today? And the answer is no. But I work with a group of professionals who saw that I was a little too excited about this shower, and they helped pick it up. When I think of how we pick up for each other every day, for some of us, it's just grabbing that bag out of the fridge for us. For some of us, it's once again in oncology, trying to find a vein somewhere. Until that port is ready to go, getting lines started is so difficult in someone who has not too much left as far as circulation. Once that goes in and I shouldn't say slam them, but slam them with fluids, those things start popping up all over. And we realize, you know what? This disease, cancer, certainly in many ways does not bring out the best in a human. But it also brings out tenacity and a sense of self that many people never in their life get to be that introspective as your patients during their journey. To me, it's about finding out when people say, what brings you back? You know what brings me back? My patient, their family, and you? Yeah. Also, I love what I do, so I read about it. I'm interested in it. I'm done with TV reporters who report this much of a new treatment and make it sound like cancer will be gone at 10 tomorrow. I remember exactly where I was, and it was before many of you were born, when 60 Minutes had the first hospice nurse. No one ever knew a nurse could do anything until she spoke up and said, here's what we're doing. That's before, you guys, the treatments that we have today. You know, think of your speaker last night. That drug right now is showing 3.3 months from the outside to the people it matters. 3.3 months that I can still be with the people I love the most. What's the name of that drug? It is amazing to me when people say, what brings you back? You know what? I just want people to know, if you don't like what you do, you have permission to go. Because the last thing we need is one more nurse. Oh, this place sucks. Oh, I hate this place. You know what? Go. There's the door. It's even open for you. I would rather work one shift shoving a washcloth in my mouth, laughing in the break room with you, than one shift being miserable. Life's hard enough. People say, oh, if you work in ambulatory, you just see your patients and everybody leaves at 5. Where do you live? I know more. If I was speaking for you, I would say, I know more about insurance than you will ever understand. I used to work in critical care, neuro. I will tell you this. I didn't know anything about money. I just ripped open the plastic and it flew through the air. When I think of how much now I was messing with, and I had no idea. Every colleague in ambulatory knows. That's why, you know what? It's not about my own personal pride. I'm not sure if I can do this. I'm going to go ask you. You have a lot more experience than I do. You come help me do this because I'm not wasting this. I think the accountability to finance is much stronger in ambulatory. And I think it's because we all have a very real understanding of what this care costs to people. And it's always about, well, some people can get help. Yes, they can. But the majority of us in this room would fall in between, wouldn't we? We have insurance, but it's not 100%. We don't qualify for programs because we were. In other words, a lot of our families are trying to figure out how they're going to make it with these expenses. So thinking about those things, I would just say, just for one moment, if for those of you who are still on your phones, if you can put them down, that would be awesome. But for the rest of you, would you close your eyes for 1 second and think to yourself, what family comes to your mind or patient? And then just open your eyes and think to yourself, what was it about that patient or family that made them come to your eyes? Is it someone right now? Is it someone from the past? Is it someone that you've heard about their diagnosis and know they're coming on Monday? You guys, our patients stay with us. When I worked ICU, one thing I noticed right away is that ICU patients never remember you. And that's good, because that means I'm medicated well, right? But all I know is when I worked in Iowa, I could be at the mall and I would see usually an older woman pulling an older man toward, oh my God, that's Faith, that's your nurse, come on, come on. Now the guy's looking at me like, who are you? I'm looking at him thinking, neuro ICU, yep, there's the trach scar. So she brings him up. This is Faith, she was your nurse, she took care of you. You know, I shake the guy's hand, you know, very nice. And I walk away thinking all of a sudden about the flood of memories that come into my head. I can't believe every year that I'm in practice, more memories are stored. For some of you, when you're closed your eyes, a patient came to your head that you hadn't thought about in a long time. They're in there. They're in there with, can I say, some of their family members. We've met family members that you think this is not a family. You guys are sick. This is sick. When someone has to tell me the rules of their family when I meet them, that's how I know a dysfunctional family. Hi, I'm Faith. I'll be caring for you today. All right, now listen. We've got a restraining order. She slept with him, so she can't. And I'm just standing there thinking, too much information. When people have that many rules versus that one kid, college kid, or a younger one, who can come into the room and everyone's happy. When a college kid shows up in infusion for grandma, it's a big day. The, quote, church friends, who so many of our patients have, because at this point in their life, they're now alone. But by gosh, these two people from their church make sure they get there, they get home, they take them to lunch. You can't put a price on a relationship like that. Not always is blood better. You know, there are some friends that I just look at and think, who needs a family? They have you. Think about that, and then think about how we put rules on things. What brings you back? Seriously, we laugh about it, but we don't come back for policies. We come back to give the best care that we can, and in the specialty you're in, you have a hunger for knowledge. Because it keeps changing, doesn't it? Let's show our age. Anybody here remember when CTs began? Oh, please, I am not that. You're telling me all of you started with CTs? I doubt it. MRIs, CTs, the lab panels we can get now. I think of what we did. I think of a patient that I had in Columbia, Missouri, as a public health nurse, and it was something called cobalt. They burned a hole through her, so my job was to go 3 times a week and pack the abdominal wound, then go around and pack the back wound. Okay? This was cobalt. We didn't really know dosage then. They burned her on both sides. I was young, new. I had never seen anything like that and never have again. Because now we have more safety. But I understand that if I had the disease that she had at that time, I would have said yes to cobalt. I would have said yes to anything you told me. Have you ever noticed when people first get the diagnosis and all their friends, I think if you'd strain tea and let it ferment, oh God, I mean, some of the stuff. It's just like, I'm not that sick, I'm not drinking that. But what I always think that patient was there to teach me was that what becomes the standard here didn't start out the standard. Which to me, when I look at everyone here who is painfully young, I will say this: you will nurse through medications and technology that we don't even know is coming. How exciting is that? In neuro, where I work, the big news is about stroke prevention. It is very much about what we can do in the first 42 minutes after an ischemic stroke. But the actual rehabilitation hasn't changed in a long, long time. We know that Medicare will give this affected arm 6 weeks. If it doesn't come back in 6 weeks, they stop paying. Some people's arms don't come back for 3 months. It's getting people to understand nursing is a great profession, and I tease, and the reason you laugh is because you thought it. I just said it, okay? That's the only difference. It's just getting people to understand we are on the brink of something new every time in healthcare. Oh my gosh, I used to work in OB. Now they got pools. They got people on all fours. They got stuff going on there that I'm just too old for. It's just understanding that what you knew to be true will change, and a good research entity knows there's always something new coming, and yes, our shift would love to trial that because it has to be better. No matter how wonderful the care can be right now, it has to be better. Because we've got to give people longer if they want it. Have to. So let me ask you this. When you think of what brought you to this specialty, there's a word that I want you to be careful of using, and it's a word called hardiness. And a lot of things since COVID have said, I think nurses don't have good hardiness. I will slap you. Do you understand? If you worked in healthcare during COVID, I don't care if you worked in the ICU. If you worked in the healthcare during COVID, you saw or were aware of more death than any generation of nurses that is living. Period. Atlanta, I can only presume what your record is. That's amazing. I can't imagine what your record is, but I will tell you this, that a dear friend of mine is the CNO at a huge hospital in New York City. The morgue trucks pulled up. She could see them from her window. They were filled. They left every 2 hours. You heard about New York City and what happened. Don't talk to me about hardiness. Don't talk to me about hardiness, because in the world of oncology, what happened for those first few weeks, months, what happened? We don't know. What can they come? We don't know. Should we just stop all treatment immediately? What are we going to? We don't know. And for the first time for a lot of us, there's always someone in the building that knows. Nobody did. But I will say this about COVID that I will think all of us will be able to say as oral historians. Yes, I was a nurse in that time. Yes, I saw a major city come to its knees. I remember looking out the windows of the hospital that is in my town on a very main street. There were no cars. There were tents all around the hospital. The ED would not allow anybody to come in. They were all seen in tents. I don't see that as a wonderful thing to remember. I see it as a part of history. Now let me tell you, the new COVID vaccines are out. Now there's ads. There's things on my phone telling me the best time to come and get it. And a lot of people just see it as it's done. They haven't been in extended care with long-haul COVID. You may know someone in your kid's school, church, however you know people, someone's family who has someone who has long haulers and can only be up for 15 to 20 minutes a day. When people say COVID's gone, I always think, well, you're not too bright, are you? I mean, come on. It's here to stay, but the legacy that we have from COVID is this. How did it affect you in oncology? What will we do when the next thing comes? What did we learn? What treatments really could be stopped and started without much difficulty? And what cancers needed us to go all the way back to square one? That's what we learned. It makes me insane when people say, oh, you're a neuro, so you didn't have anything to do with it. Yeah, I did. We all did. And any nurse who, for whatever reason, could not practice, maybe in the very beginning, if they were pregnant, we pulled them off. Nobody knew what was going on. And those nurses had a squirt bottle on one pocket of their scrub and a rag, and all they did was wipe doorknobs. And to this day, we all laugh about it. I don't know why we thought COVID was just on the doorknob, but we had staff all over the building wiping doorknobs. Now I'm thinking perhaps it was in the air. I don't know. I want you to think for just a moment about spiritual and psychological and what's the difference between those two. Spirituality is who you are, unique and alive, and your relationship with a higher power. You and I know people who have never, ever missed a Sunday. But they got a heart that's pretty cold. You and I know people who have never darkened the door of organized religion. They are the kindest heart you have ever met. In this environment, where this resort sits, is where a lot of people find their spirituality in the natural beauty of this area. To me, it is the spirit of the patient that I miss. It is not that important, please don't misunderstand, what religion they are. But somehow that's a question we always ask, instead of, how are you today? How are things with your family? How's your daughter handling things? I love Zoom. I love everything you can do with a phone that can connect people. I have family in the Philippines. And let me tell you, we stay connected with the gift of technology. That's it, you know? And when people are getting their infusion and we can get someone's face to come up on that screen for them, oh my gosh. And you and I know that there are some people who I call visitors. And they show up and they're not going. And they bring a bag. They always have a bag full of stuff. And they sit in infusion, and they don't talk to the person. And I always think, you need to go. I would rather connect this person to someone whose spirit touches theirs. It's called tithing. It is that look that every person who has ever birthed a child that you have when you look down. Your spirits melt. During chemo, radiation, signing on for a new trial, those are moments when tithing is needed. I don't need you to tell me what Reader's Digest says. I need you to tell me I'm here for you. Oh my God, I just threw up all over, and when I threw up, I evacuated my bowel. Oh my God, I gotcha. Let's get you into the other room. I gotcha. And you know what? I'm taking it home because the only thing I care about is getting the smell out of your bedroom. I'll take it home, clean it up, bring it back, put it in your drawers. Don't worry about it. I gotcha. Think about how in your practice every day, as a researcher, as a leader, as a manager, as a nurse, no matter which part of oncology you work in, how do you tithe? Where do you let yourself open up to the person on the phone? You know, if I could only convince some people who keep data, people who miss appointments usually weren't home eating bonbons, watching TV. That bus didn't come. That car didn't start. People miss appointments usually because of life that is out of control. And so when a person has a missed appointment, I never want to be someone who says, that's your third one. Get to 4, you're out. Right? Who are those people? I want to say, tell me about Tuesday. I am so embarrassed that my son took the car and we only have one. He doesn't have a phone. I couldn't get a hold of him. All right, let me see what I can get you. I'm not going to punish you for missing. But when you come, I want to make sure the nurse who's going to care for you knows the reason you missed, so they don't make you tell the story again. A dear friend right now is receiving, she had a double mastectomy, lymph node removal. She finished chemo and she's about to start radiation. I have noticed there are certain questions everybody asks, because I take her to every appointment. And I'm about ready to punch somebody out. It's called epic in my world. Right there on the screen if you just read it. We're coming every day, so if something dramatic happened in the last 10 hours, I'll let you know. They have to do her blood pressure in her leg every single time. No, not my arm, my leg. They take it in your leg? Yes. I don't know how to do that. Get on your knees. I'm going to show you. It is understanding, we all know this, when someone you care about comes into healthcare, we see our work completely different. And I want to pinch a lot of people. But I also think of the time that she had a rough day. I had left. She was by herself. And she told me about the nurse who came over and said, Maggie, I heard you're retired from here. You used to run the sterile processing department? How big was it? Where was it? She loved being able to tell them about a part of her that no one had seen yet. No one cut, no one burned, no one infiltrated. She had a career, and they let her talk about it. When I say what brings you back, I would say what brought you here today. What brought you here today? 15 years. Look at this room. In a world of Zoom, a lot of people don't make time to come to the conference. You guys, it's more than the snacks. It's the pride you had when the name of your area was called. Some of you were real happy to hear your clinic called, but it's getting people to see, I like being with people at work, outside of work. I like being in a room with people who know we're here to learn. Yeah, it is fun to go out to the bar. It is fun to go by the pool. All of those things are fun, but when I'm in a room of nurses that are learning, respect goes through the roof. Look at the options, the discussions you're going to have today, and understand what ties our practice together will be this. It is the ability that you have to push yourself today and say hello to a colleague that doesn't work with you. It is the ability you have today as a newer practitioner to thank one of the nurses in this room who has helped you. It is the ability you have today to turn to a colleague and say, man, we've been working together. I just thought, 13 years, you know more about my marriage than my husband does. That is the part of caregiving that I love. We talk about our attention to our patients. That is, to me, that is a given. It is how we treat each other. I make fun, of course. Our hospital, I don't know about your clinics and hospital, our clinics wear the same color scrubs. The hospital, each color is a different floor. You know, and sometimes I just want to thump and say, you guys, look past the scrubs. Look at the hearts. People get on the elevator and don't even look at me or say hi. And I've done that too. But now when I get on, I greet every single person because bringing Maggie has shown me a few things. Number one, that bell they ring. Okay, if you're not in your specialty, I've always known it is a big deal. So it was the day for Maggie to ring the bell, and I invited some SPD techs to come over from the hospital. We're joined by a walkway. The person before her was so excited, they broke the bell. It fell off the wall. I mean, they were excited. And I remember when they first told me, I laughed my head off because I'm like, I want to meet that person. You finished chemo and you had that much strength, right? But then it hit me, there's no bell for Maggie. I mean, it really, and I couldn't believe how they did it. They just came and said, all right, Maggie, you're going on an elevator you've never been on. Took her to radiation so she could ring the bell. Those are people who saw, that's going to add 5 minutes, I'm going to be late. Oh. You know, some people are so tight that if I right now put a quarter at every single person's place and said, you guys hold your quarter up, you guys would do it. And I'd say, stand up, and you do it. And I'd say, now take your quarter, squeeze it between your butt cheeks, and hold it there for the rest of the morning. Notice how many of you would say, okay, all right, I'm doing it. So my advice to you before the rest of the day comes is drop your quarters. Life's too short, folks. What brings you back? What brings you back every day is the spirit inside of you. What makes us frustrated? The spirit inside of us. I just think that too often we get caught up with emotional and we forget spiritual. It's part of who we are, and it's different for everyone. It really is. So I just will close with this. I will tell you it is one of my favorite oncology stories because it happened to me. Okay, so we had a time where Medicare would pay for oncology rehab. Now I would assume the majority of you have never heard about it, but what it was is back then with cobalt and chemo, people were left pretty much, a lot of them bedridden. They were completely zapped by the treatment, and we didn't know what to do, so they would say to them, tell me one thing you want to be able to do. I want to be able to climb my own stairs to get to my bed. I'm not sleeping in the front room. I want to be able to do, and they were usually very specific goals, and PT would look at them, assess them, and say, we could do that in 4 treatments. In other words, flip them over to rehab. They're going to have a 2-3 day stay. Medicare paid for it. It was awesome. And I got a woman named Norma. Norma was 84 years old, zapped by years and years of cancer. And to be real honest, I don't think I read back far enough to know where it started. My job as a neural nurse was to make sure we got her strength built up that she could climb in and out of a bed and do 4 steps. They lived in a bi-level. They only had 4 steps. Day 3, we're ready to go. Doctor approves. She can go home with her husband, try it on her own steps, come back. If it went well, discharge. Now, you know you can't do that today in Medicare land. But I love cancer rehab. Our whole unit did, because the patients didn't stay long and they had such specific goals. And most of the time we were able to meet those goals. It was awesome. So I'm putting on her TED hose that day. She's getting ready to go with her husband to go home. And you know what I loved about TED hose? Is that you put the person's ankle on your shoulder. So no matter how you did it, if you get my point, it's just awkward. So I would always be, so what's new with you? So I said, what are you up to today? Even though I knew. And she said, oh, my husband's picking me up. We're going to do the 4 steps. If I do them, we're going to run real quick by the medical supply store, come back here, and I'll be discharged. I'll leave this afternoon. Oh my gosh, that's wonderful. Since you can get 4 steps up to your own bed, why are you going to a medical supply store? Oh, we have to rent a bed. And I remember I just put her leg down and I said, Norma, Medicare will not pay for a bed. You do not qualify. If you can get up and get in your own bed, why would they pay for a hospital bed? And she goes, oh, I know, we pay for it. I said, you get a hospital bed every single time you go home? Yes. Why? Sick. 84, she knew more than I would ever know at that age. And I thought, oh my gosh, I wonder if she thinks cancer is contagious. Some of you have met patients who do. And I said, Norma, do you think I can get this from you? She said, no. But I'm sick, so I shouldn't sleep with my husband. And I was thinking through cobalt, countless infusions, thinking, oh my gosh, they haven't held each other. What's wrong with us, right? Why don't we ever ask the questions nobody likes to talk about? So I just looked at her and I thought, I got to start from the beginning. And so I just said, Norma, cobalt wasn't a good treatment when it first came out. My gosh, you've told me about what it was like, and I've seen the wounds. Wow. If I was in bed with someone I cared about, I would just make sure I covered that. And I know that you had a burn area where they took your breast. You know what? I would just keep that covered a little bit. But you can still love another person. And she was staring at me, and I'm thinking, go for it, Faith. I'm a rehab nurse, so I always have one thing in my pocket. KY jelly. So I pulled out a little packet and went like this. To an 84-year-old woman, I did this. You might need to feel wet. Boom. The only thing I can tell you is this: she caught it. She left on pass with her husband. About an hour and a half later, they come back. She's in the wheelchair, he's pushing her, they're both smiling. And she said, "That's her." And he handed me a box of candy. I will just say that I had to go to the dirty utility room and take a deep breath for a while. And you have no idea who Andrea Shields is. But Andrea was the first nurse who heard me stammering in a room and pulled me out in the hall and said, "Faith, this is rehab. That is spinal cord. It sincerely affects every part of his life. You are going to learn how to educate about sex." And I remember thinking, isn't that the doctor's job? And she's the one who told me, no, they just tell them they can. They don't tell them how. They just say, you can do it now. And because of that, my practice expanded. I know now because I've been asked to go to oncology many times. When people said something, people got nervous and they say, "Faith, will you come up and talk?" Sure. You don't have to be an oncological miracle person to figure out burns, pain. It's not hard. The teaching is not hard. It just seems to be a part we all forget. So, I unfortunately did not hit my timer when I got up here, and I have a painful idea that it is really late. So let me say this to every single one of you. No matter which clinic area you're from, number one, thank you. Thank you for what you do every single day you are here. Not just in the clinic. Every day you're here. I somehow think neighbors, families, and friends send people to you. "Oh, you're going to call my cousin. She works over at Emory." According to them, you are the lead oncologist of the Cancer Center. You guys, just don't forget this, please. You do the most important work in the world because you're doing the work of human life.